Friday, and that means you are stuck with me for another community conversation, this time featuring medical professionals as we talk COVID-19 and the Black community. My guests are here, so we're going to go right into introductions. I will start with Miss Brittany. Introduce yourself, please.
Hello, hi there. My name is Brittany Shipman. I'm a psychiatric nurse practitioner. Essentially, I am really devoted and dedicated to providing holistic, comprehensive care. So I'm here to talk about the emotional aspects of COVID-19 and how it affects the Black community.
Good evening, everyone. Thank you all for the audience, and thank you for coming out. My name is Dr. Stephen Noble, or Dr. Steve. I'm a board-certified cardiothoracic surgeon, which means I specialize in the surgical treatment of heart and lung disease, the number one killers of Americans, both heart disease and lung cancer. Here today to kind of give a different perspective on coronavirus, especially in particular to the Black community, my concerns, as well as what we can do during this opportunity in which we can really reevaluate and reassess some of the things within our community. Thank you for your time.
Medical consultant. Went to medical school at UC Davis and graduated in 2005. Did a residency in family medicine and psychiatry in 2010. I've been a full-time medical consultant for the last 3 years. And in part of my consulting work, I have been a public health consultant and have been particularly busy in these last couple of months, as you can imagine. One of the things I've been working on is the global health response to COVID-19, and have been particularly interested in comparing the global health response to the current US response, which I feel has greatly undervalued the African-American experience, and want to be able to talk about that. Really glad that you all are here for your questions, and I'm glad to be part of the panel today. Thank you.
Hi, I'm Dr. Fields Gilmore. I'm a family practice physician for Baylor College of Medicine. I teach residents and students. I'm a director of a course called Compassion in the Art of Medicine, and I'm interested in the COVID-19 infection, the disease, the pandemic, and how it's affecting everybody, particularly the African-American community.
Dr. Betty, I don't know if I introduced myself. My name is Laureen Pryor, and I'll be taking you through this Friday drive as we tap in with our medical professional. I'm sorry if Miss Betty is here. If she is not, we will move on. So if you can put my panelists up, I just have a question, and we're going to get right into it. The numbers that we're seeing, are they true? Should the Black community be alarmed by the numbers that we're seeing through the media? Dr. Noble?
I think that there should be some concerns, as far as the numbers that we see. First and foremost, you got to be concerned of governors or any sort of individual feeling as if we can pop our heads out of the sand. The United States has only tested 1% of the population, and based upon 1% testing of the population, we closed the whole nation down. And so until we get better testing, until we get more testing out there, until we get more data, I think we should be concerned. And so with that, I would be very cautious about a full sort of all clear, if you will, as far as returning to life back to quote unquote normal.
Dr. Fields Gilmore, should we be concerned with what we're seeing?
We absolutely should be concerned. There's not been enough testing. We already know that this virus is pandemic and it's ubiquitous. So we don't know who has it and who doesn't have it. And so if you open it back up, then you're going to open yourself up to being exposed to a lot of asymptomatic people with mass spread, with that second wave and second peak that we've been talking about. So we definitely should be concerned. The numbers that we see, for example, here in Houston, we have different numbers all the time. And it looks like the curve is coming to a plateau for us. However, we did open up some businesses today, and they're going to start slowly opening things up in Texas. So we should definitely be concerned.
So the issue then, to me, sounds like testing should be at the forefront of anything that we're doing at this point. Dr. Joby?
Yes, absolutely. So as Dr. Steve mentioned, so we've only tested 1% of the entire population, and we've made quite a few policy decisions based on that small number. So in order to be able to have an effective public health response, testing has to be an absolute part of the solution. So when you are trying to figure out what you're going to do about having a virus that has hit your community, you have to be able to do something along the lines of a public health basics. You have to be able to test in a widespread manner, figure out who has the virus, and keep contacts with the people that those people have been in association with. So if they've had communication or a contact with other people, those people need to be traced. Those people need to be contacted, and that is how you go about the process of containment. That is going to be that, along with physical distancing, is going to be our strategy until we're able to develop herd immunity, meaning that enough people develop immunity to the virus, or we get a vaccine, which is going to, either of those things is going to take quite a long time. Vaccines at minimum are going to take 9 months. Herd immunity will take, may take a lot less time, but cause a lot more damage.
Right.
So explain that to me. When you say herd immunity can cause a lot more damage, what does that mean for the average person who doesn't speak medical language? What does that mean?
Sure. So herd immunity refers to having enough of a population displaying immunity to a virus that the virus cannot spread as efficiently as it has right now. So when we first had the virus come to the United States, no one or very few people had ever seen a virus like that. Their bodies have not been able to figure out what to do with it. They haven't had a chance to be able to build a defense system for it. And so as people do that, the virus has a lot less attack. It's basically kind of like the way that a burglar would attack a neighborhood. If everybody's got a home security system in their neighborhood, the burglar's less likely to be able to commit a lot of crimes. So that is essentially what you have for your body, and that is what we have to have as an entire community in order for the virus to be less effective than it has been so far. That takes a long time, but unfortunately, that means that people have to get infected with that virus. And in our community, that means that people are going to be having the damage that comes along with having that virus. 80% of people don't have symptoms when they contract COVID-19, but 20% of people do. And in our communities, those symptoms tend to be a lot more serious.
Okay. So
on top of that,
okay,
on
go
top
ahead.
of what I just want to piggyback on what Jobit was saying. On top of that, if you do get the virus and you recover, that doesn't necessarily mean that you have full immunity. So, because we're learning so much about this virus, it's brand new. And so we can't be confident and kind of be cowboy and say, well, I've already had it, so I can't get it again. It's like when people get the flu and they say, I've already had the flu. How am I sick again? You can get the flu again.
Right.
Same thing.
So I was reading and it says that as of right now, there are 30 different strands of the virus. And I know that Dr. Noble, we were talking about there's this interchangeability that's going on between the words virus and disease. Can we talk a little bit about that? And if we could just put Dr. Noble up, can we talk a little bit about the virus versus disease wording?
Yeah, so I mean, I think it's a matter of semantics. The virus is, the SARS coronavirus is what actually causes the disease. Is what is infectious. And so the virus, can be contracted in a variety of ways, respiratory or airborne droplets, contact as far as it being on a surface, or what we call a fomite, meaning someone sneezes into their hand and they have the virus now on their hand, and then they grab a door handle, and now that door handle is a fomite or carrying the virus. So that's the virus. But the disease itself, the problem that it causes within inside the body is that this virus can affect the respiratory system, the cardiovascular system, the heart system, as well as the GI tract. And so those things, as far as the fevers, the respiratory inflammation, needing to be on a ventilator, needing home oxygen, all those things are the effects of the virus on the body, and thus the disease. And that's where this virus is very, you got to admire it to some respects, because it is very able to kind of slide and hide underneath the radar. A virus that has symptoms similar to the common cold, similar to allergies. And as one of the panelists mentioned, that's why you can get the flu so often, because there's different kinds of viruses. You may have, one type of the flu and then may get infected with another kind of a viral flu, because there's so many different types. The common cold, there's about 117 different what we call serotypes of the virus that can cause the common cold. And that's why people can get sick several times within a season. But the disease itself is what causes people to be on the ventilator. And that's kind of the manifestation of the virus inside the body. Fortunately, 80% of people do well, 20% do bad. But even in those 20% that do bad, they can have some long-term effects, upwards to about 20% decrease in your lung function, meaning that even if you recover from coronavirus, you may be able to feel short of breath when you walk up some steps, when you walk to the mailbox, the post office, and that's very concerning for an individual like myself who operates on people in which I have to take out portions of their lungs.
Wow. I know that when we started to hear more about this virus, I just wanted to know, and anybody can jump in here. How did Black folks who rarely go out of their own neighborhoods become the face of this disease? Dr. Joby, I'll start with you. Your mouth is moving.
I'm talking loud, but saying nothing. I'm sure about that. Yeah. So part of the way that Black people became the face of this disease is because their symptoms tended to be a lot more severe when they got it. So there's nothing intrinsically about Black people that makes them more likely to get disease. Let me say that again. There is nothing intrinsically about Black people that makes them more likely to get infected with the coronavirus that causes COVID-19. Okay, so understand that part first. However, there are a lot of systemic factors that make Black people a lot more likely to come into contact with it. They are on public transit more. They are in areas where they tend to work in environmental pollution. They are in areas where they tend to work in close contact with other people. So those things tend to bring Black people into more contact with more virus particles. More virus particles tend to cause more disease. So that's one issue. The second issue is that there are some comorbidities, some coexisting diseases that tend to make the virus infection a lot worse when the disease tends to manifest. So some of those are things that are really common in Black communities, like high blood pressure, diabetes, cardiovascular disease, asthma, something that I bet Dr. Fields Gilmore probably wants to talk about, G6PD deficiency, and sickle cell anemia. So all of those things can make the disease process a lot worse. I almost didn't mention autoimmunity. So things like rheumatoid arthritis and lupus, they tend to make the immune system, so like remember that home security system analogy that I made. Imagine that everybody saw a burglar in their neighborhood. They all got their guns out and started shooting at each other, shooting at the burglar. Some of those are going to basically hit the other houses, and that's kind of what your immune system does when you see a virus. Your immune system goes and basically says, heck no, I'm scorched. You're getting out of here. But it actually ends up causing a lot more damage than it would if it just sort of ushered the virus out of a side door.
Dr. Fields Gilmore, the question that I'm seeing, it says, can someone explain where this virus came from? Where did it come from?
Okay, so what we know from the news is that the virus came from China. It's supposedly a part of a virus that affects bats. And that one of the alleged things was saying that it was a wet market. So it's kind of like a seafood wet market in China, and it was transferred, not understanding, was it transferred from a bat to a human? That's still kind of the gray area. So that's where the virus supposedly came from. We've also seen in some of the research that it could be found in an animal called a pangolin, which is an anteater. But it's a zoonotic virus. So a zoonotic virus means that it comes from an animal and then it jumps to the human. Okay.
I'm speechless.
Do you want, I mean, it's kind of like what Joby was saying, or Dr. Joby. I went to residency with Dr. Joby. But as far as the African-American community, a large percentage, by and large, we have diabetes, we have high blood pressure, we have asthma, okay? We have COPD. And so that's gonna set us up to being more susceptible to having a more severe reaction to this type of virus, since it's respiratory. It is a respiratory virus. And so it's going to go into those lungs that are already compromised. It's going to affect that heart that's already compromised, okay? We know that diabetes affects the blood vessels. It affects the small blood vessels, right? So it's going to go in, and you're already compromised because you have diabetes, especially if your diabetes is uncontrolled. And then you've got this virus, and it just comes right on in, and it makes you sicker quicker than populations that don't have those susceptibilities.
Dr. Noble, the question is it true that the virus can replicate?
Yes, I think this virus kind of acts similar to other viruses in that when it replicates inside the body, some of the effects that it has within the body. And so for all intents and purposes, you can, think that it does replicate, and you actually kind of need the replication to occur so you can develop the immunity. So the body, as Dr. Joby mentioned, really needs to figure out a way to fight that immunity or fight that infection and get the virus out of the body. And that's where the immunity comes into play, which leads to, the testing and the serology testing. Unfortunately, the serology testing hasn't been as great and hasn't been as accurate as we had wanted to be. And it was really going to be that serology testing that said, hey, look, you have been exposed to the virus. And one of the key things that was brought out yesterday was Governor Cuomo kind of gave the preliminary results of his study. It was either today or this morning, or yesterday or this morning, in regards to they tested 3,000 patients randomly. They went to the grocery store, tested 3,000 patients across the state of New York. And based upon that study, what they found was that about 14% of those random 3,000 people that they tested across the state have antibodies to COVID-19. And so this kind of gives us a snapshot of how do we go back into society. But the question does remain, what does that mean that you have antibodies to COVID-19? Do these antibodies that you have, do they protect you? That's the real question. Do the antibodies that you produce, does it protect you from getting this infection again? Because if it does, as we hope it will with other viruses, but as it's been explained before, this is a novel situation, which means that no one within the past 100 years has ever experienced anything like this before. So there's really no experts in this sort of situation, just people that are experts in their field, hoping to apply their knowledge to this novel situation. But we don't know if those antibodies actually give us immunity or prevent us from getting that infection again.
So let's talk about it, because when this virus, disease, whatever, rolled out, there were a lot of myths associated with it. I know I've heard if you had melanin, you couldn't get it. I've heard the myth about 5G. Is there any truth to the 5G scenario that's being presented to our communities as being the reason why this virus is affecting Black folks in the way that it is? Dr. Fields Gilmore, I see you done straightened up. That means you got an answer for me.
There is no evidence. There's no evidence. It's kind of like what I discussed with other people before. 5G, same as 4G, maybe a little bit stronger, but it's not one of those things where that radiation from 5G is going to make you more susceptible to specifically COVID-19, right? So there's no evidence proving that the fact that we have 5G now, which is supposedly giving out more radiation than the other Gs that we've experienced, then is going to cause you, especially just Black people, to have an issue with COVID-19. That's a myth that needs to be dispelled.
Thank you for that. And did you all have a problem with the way this virus was rolled out in our community? It seemed like there was a lot of misinformation, like you had to be older to get it. that it didn't affect young people at the rate that it affects the older folks. And so we had to protect our senior population. But it didn't talk about the essential workers. It didn't talk about the different places that have concentration of Black folks, and there doesn't seem to be any real resources being pointed to those hotbeds. Did you have a problem with the way that it was rolled out in your areas?
Oh yeah, I mean I did, and I think that this is where we as Black people, we as a community, for us to have victory, there are two things. One, we need to be vigilant, and we need to vote. And I think one of the messaging pieces of this was it starts from the top. First and foremost, our leadership with the administration, as well as the CDC and the WHO. I was very frustrated with the CDC as a healthcare provider because their guidelines were changing as the days of the week were going by. And it's in our area, in the Sacramento area, in which those individuals at UC Davis pointed out that there is a person that does not appear to have typical flu-like symptoms. And they tried to get a COVID test 3 times. They were denied 3 times, but it was on that 4th time that they got that COVID test and that patient was positive. So the first time that we knew about community transmission was right here in the Central Valley area. And so the frustration was this whole notion of us thinking within inside this box that you had to have traveled to China, that you had to have a fever, that you had to have all these things. And we really weren't thinking outside of the box. And so when individuals like myself and others were recommending to the community, we don't know about this, so everyone needs to mask up when you go inside. And then you had individuals at the top saying you shouldn't go out and get masked, you shouldn't be outside wearing masks. Right. That sort of messaging, and I see a question in regards to can UV light in other situations be used to kill it? That's what's hurting people, the poor messaging. And I would really just advise both the CDC, the WHO, the president, to have unified messages to get out to the people. And it has really been the work of our local government, mayors in San Francisco, mayors in LA, the mayor in Atlanta, Keisha Lance Bottom, the mayor in New Orleans, really doing the yeoman's work to kind of get the messaging and get their community behind it. But I was very disappointed with how the messaging of this virus and the misinformation that was being promoted was out there, because it really did hurt people.
The question in the chat says, my BMI is over 40%. What can I do on a daily to equip my body for possibly fighting COVID-19? Dr. Joby?
I might want to defer to one of the practicing physicians
for
this one, but I will be able to say one of the best things to do from a public health standpoint is to be able to follow the guidelines. So be able to sort of maintain appropriate physical distancing. You're wearing a mask out in public. I think there has been a lot of dispute about whether or not that is helpful for somebody who does not know whether or not they have COVID-19, but is helpful to prevent people who do have COVID-19 to prevent their spread. So both of those things are helpful. But the question brings up a really great point in that people who are obese, even if they are not older, even if they do not have other comorbidities, other co-occurring kinds of conditions, are at higher risk. So the young people that tend to be getting more severe illness of more severe COVID-19 symptoms tend to be obese, and so that has been a major factor. My cousin, who is age 52, is actually still on a ventilator over at U of M Hospital. Part of the reason why that's the case is because of obesity. He's had other comorbid conditions as well. But this is a real situation, and it's a real question, and one that I can certainly identify with pretty strongly.
Thank you for that. And before we move on to the next question that I'm looking at, Dr. Noble, we were talking about the masks, and a lot of folks have been saying, N95s, and, you can use coffee filters. And what can you tell us about these masks, and what should we know to keep ourselves healthy about masks? What should we know?
So as Dr. Joby mentioned, the masks are just that, the recommendation that individuals had about masking up when in public was because of the notion of most of the spread, or a significant number of individuals that of spreads that can occur, is from asymptomatic individuals, meaning you don't know that you have COVID-19, but you're spreading it to others. So the recommendation was put on a mask when you go out in public for everybody, because if we assume everyone, or if everyone acts as if they have COVID-19, we can decrease the spread if everyone has a mask on. So the masks, so these are the surgical masks. This is a mask that I would use in the OR. These masks are single use. They tie up in the back. They really don't protect from droplets or anything of that nature to any significant degree. If I cough or sneeze, then that sort of spread does not happen or occur. These are the N95 masks. They're different, and there's different varieties of N95. And what that N95 means is just that, you know, the particles, about 95% of the particles, you know, don't get through. And so it's very very microscopic and small. But these are also single use. So typically prior to COVID-19, we would just use these masks one and done, and that'd be it. There are other masks that are out there on the market. This is more of a mask that you can get off of eBay or Amazon. And on the inside, the mask, it has a removable filter. So there have been some individuals that have used this opportunity to make masks of their own and create a slit or a pocket in that mask so that they can fold coffee filters or several coffee filters and tuck it into that mask. And the thought process is that any sort of barrier is better than nothing. And that's really the biggest thing, is that something is better than nothing when you go out there to prevent transmission to other people. And if it prevents you from getting a major droplet, then, you know, that'd be nice. But it's really meant to prevent you from spreading COVID-19 to someone else.
Okay, let's move on to this next question, and then I want to bring in Miss Brittany. Flu vaccines are encouraged each year, and the type of vaccines change each year. Will it be the same for COVID-19 when a vaccine is developed? Dr. Fields-Gilmore, will that be the same?
We don't know what the vaccine is going to be like. It's going to take a year to 2 years for that vaccine to be operational, to go live, if you will. So because COVID-19 is not like the flu, we don't know if there are going to be different strains and different types of vaccines every year. We would assume so, because it is a virus. However, I can't say yes or no.
Okay. And just on that whole vaccine tip, so I had a chance to see some of the statements from Ms. Kizmikia Corbett, and it brought to mind because of the things that she said, and I don't think that I should read them, but she did refer to Black folks in derogatory terms, and that brings us back to the whole mistrust that the Black community has with the medical industry. It brought back thoughts of Tuskegee experiment, how they used a Black woman to infect a Black man, and they took that home to their wives, even though they had a cure on hand. And so in dealing with people who are experiencing the anxieties, the just not knowing, the discomfort, Brittany, what are you seeing as you try to assess the psychiatric needs of the community?
Well, given that we're living in unprecedented times, it's really difficult for people to find any comfort with so many unknown variables. And so people that typically suffer from anxiety, or if they don't, we as a collective, we are all experiencing a heightened sense of anxiety. So now more than ever, a good thing to try to keep in mind is self-care. So coping skills, keeping a regular routine, good sleep hygiene. So trying to, account for the 8, possibly even 9 hours of sleep could lessen the mood fluctuations, the anxiety, feeling on edge, uneasy. It really, really does speak to having more awareness for self-care. And so essentially, I just really feel like the essence is do we have coping skills? And sometimes more often than not, most people don't have adequate coping skills. So I think if you could just focus on those 3 essentials, it could lessen some of that heightened anxiety.
And speaking of heightened anxiety, as I scroll the timeline, or I'm talking to, or not even talking, but I'm watching things unfold, I'm seeing a lot of medical professionals breaking down on social media, and that has to increase the anxiety for the people who are going to be going to see these medical professionals as they're in the midst of dealing with what they're seeing on a daily basis. Can we talk about why it seems our medical industry is having such a hard time with COVID-19? Dr.
Well,
Noble?
I think one of the situations, one of the analogies that's been alluded to is this is like a war, and less than 1% of all Americans ever serve in the military. And as a former Navy surgeon, we signed up. Even a small percentage of Americans are physicians that actually serve and deploy and go to battle. And so when you do that, you kind of are prepared for that mentally, physically, emotionally, the whole separation from your family. You kind of go through that, and you're with a team of individuals that, this is what we volunteered and said we're going to do. COVID-19 isn't like that. I mean, it just descended upon the whole world, and people that, have never been in that sort of situation are now all thrust into it. And we've never really been in a situation in which, one, we were, outgunned, undermanned. I mean, we did not have enough PPE to adequately prepare us for this. So you have providers that know how they could catch that virus, and providers that know that I'm supposed to wear this mask one time. But the CDC, my nursing executive right behind my back, is telling me I have to go into that patient's room. I can only use this mask for the whole week. I have to put it in a bag. That causes stress and anxiety. And then the whole notion of, I could potentially take this home to my family. My family didn't sign up for, to get coronavirus. So you have physicians afraid to go home, sleeping, outside in the garage in tents. Then you had physicians let's be honest, you have physicians, healthcare workers, nurses, janitors, everyone that works in a hospital literally put in a hostile work environment because we weren't given the proper equipment to do our jobs effectively. There are very few individuals, if anyone, that can do their job, in such an environment and not have some sort of mental anxiety or stress when you are going to a job that you know how to do, but you don't have the right tools, the resources, and things of that nature. So when you start seeing the police department, the New York Police Department had 12% of their individuals out with coronavirus. When you start seeing 911 go down, who is going to be the individuals that help them? And that's the same thing that you had in the healthcare community. You started to have nurses, be sick, physicians be sick, janitors that literally realize that, I don't get paid enough to do this. And they would literally, leave. I saw a janitor leave right then and there saying, I can't do this. And rightfully so. I mean, I applaud her because it's really not worth it. People need to be given the right equipment to do the job the right way, not just to kind of get by. And unfortunately, that's some of the situations that, we were all kind of thrown into.
And I want to add on to that. Another layer to it is we're trying to send this message out to flatten the curve. Everybody stay home, social distance, wear a mask when you can, do the hygienic things. And then you have certain people in populations who didn't take it seriously. So as a physician, I'm going into the clinic or I'm going into the hospital and I'm going to take care of these people. But then there's so many people who aren't taking it seriously. They're not doing the things that are recommended that will help to flatten the curve and that will help to reduce the spread of the virus. So that adds to the anxiety. And you're going to see people break down because it's like, I'm trying to help you, so help me help you.
Right.
Absolutely. And if I could just add one thing, speaking from a nurse standpoint, they're now asked to practice care in a way that they've never done. End of life care, a lot of nurses before chose to stay away from that. Maybe we're on floors that didn't really have to deal with that on a day-to-day basis. Nursing patient ratios have increased. I mean, that would cause stress and anxiety given any day without the pandemic. So nurses are being asked to provide care in ways that they haven't done. And that is unsettling. And it's hard to cope with those things.
So what would you say our nursing professionals or our medical professionals need? What type of supports do they need? I heard PPE, which is personal protective equipment, right? What else? What other things should we be providing our medical professionals to help them cope with what they're being asked to do? You said the nurses are doing things that they've never done before, and I think the other night, Dr. Noble, you were saying that there are certain types of doctors that are being called in to deal with coronavirus patients or COVID-19 patients that have never done that before, have never manned a ventilator. So what type of supports can we put into place to help our medical professionals?
You know, the most important thing that the population can do is to do what we ask them to do, is to do the social distancing, is to wash their hands, is to wear the mask. That is the most visible way that you can show support to those of us who are taking care of you. Just go by what we ask you to do, and then that's going to make things a lot better. That's my piece.
No, I get it. And the comment in the box says, or the question, it says, is it safe to visit a loved one in the hospital unaffected by COVID? And I think you just said for everybody to stay home, but I'll let anybody pick that up. Is it safe to visit a loved one not affected by COVID right now?
I'd say no.
Yeah.
And the situation is, the way that some of us have been handling this whole coronavirus situation is kind of like deployment. You go into the hospital when you need to. When you know that your hospital has coronavirus, you know, even if your loved one doesn't have coronavirus, assume that there's coronavirus in that hospital.
Yeah.
And if that's so, you have to assume that everyone in that hospital is being as vigilant as possible not to track that virus through the hospital. So you simply walking into that environment, if you press the elevator button to go to the 7th floor where your loved one may be, that is a way in which you can get coronavirus. And try not to put yourself in that sort of situation. I understand that this is, to Ms. Brittany's point, very unnerving because we're having to do things within our society and within our culture that we're not used to. Having to grieve via Zoom. Like who, prior to this would have ever heard of attending a funeral via satellite or via a Zoom conference call? And that is just so not in our DNA of who we are as a people that it's very difficult to think of our loved one in the hospital potentially by themselves. But in this sort of situation, I agree. You gotta, stay out of the hospitals, wash your hands, stay home if you can, and try to take care of those underlying medical conditions, because take care of your blood pressure during this time. Try to, eat right, exercise. If your BMI is high, try to work hard now to kind of get it down, because when coronavirus, dissipates and goes away, heart disease, diabetes, all those other things that kind of make us number one in sort of these mortality rates is still going to be there, and is going to be there even worse. And it's going to take a while for you to get into your doctor. So take care of yourself now so that when we do get out of this, you won't be so behind the 8 ball.
And so I was watching, and I think Dr. Phillips Gilmore, you put this video on your timeline, and I don't know if he was a doctor, but he was saying that, the virus is basically going to be here and it's going to reemerge in the fall. So what should we be doing? What can we be doing right now to prepare for the fall hit or reemergence of COVID-19?
Yes, I was promoting Dr. Corey Herbert. He's a pediatrician out of New Orleans. He's been doing this a long time. He's been talking about a lot of things that affect our community for a very long time. One of the things that he put on his timeline, he put up a diet for people who follow him so they could get ready for the fall. Start losing the weight now so that you can be ready for the fall. That's one of his pushes. But basically, it's just like what Dr. Fauci said. The virus is going to tell us when it's done. We're not going to tell it when it's done. So know the summer's coming up. That doesn't mean that it's going to go away. This is not the flu. And that's in the beginning of this, that was one of the most important misinformation pieces that was out there. It kept being compared to the flu. It's like the flu. It's going to go away. This is not the flu. So it's not going to go away when the summer comes like the flu does. right? So we need to really get used to the idea that it's going to be around, and we need to be vigilant about our health. That's going to be the most important.
So you would say that nobody should be injecting themselves with Lysol or any other disinfectant?
Absolutely not. And that really hurts me
Yeah.
to hear that. And he said today that he said it as like a joke or he was being sarcastic. But what's really important is I know when I say something, it's people are going to take that serious regardless. So it's just, no, do not inject or ingest any disinfectants. You cannot tan COVID-19 away. The UV lights are not going to kill it, because if that were the case, with this heat that's coming, especially in Houston, it would be going away by now, right? No. So let's use our common sense, let's use wisdom, and let's listen to the experts.
Dr. Joby, some countries have mandated wearing masks when outside. Should we be wearing a mask when or if we exercise outside?
Yeah, that's an excellent question. And so there's no great evidence that you should. There's no great evidence that you shouldn't. The recommendations are that that whenever you're wearing a mask and that you're outside, that you whenever you go outside, that you do. You know, the virus most likely transmits through droplets and has a little bit of airborne life basically when it gets aerosolized. So like if you sneeze and the droplets are sort of in the air and they're just kind of floating there, it can that virus has been been studied and has been shown to last for up to about 3 hours, but it does undergo some decay, meaning basically that the longer it's in the air, the fewer virus particles there are. But in terms of sort of day-to-day decision making, I would choose to wear one if you are going to be in public areas or dense areas. If you're going to be in an area where, say, you're running along a trail in a park, and this is what I would personally do, I would not do so, especially one that is that's been reused. That's actually some of those masks are actually likely to create more opportunities for infection than they are going to prevent. But that is going to be a matter of debate, and has been a matter of debate for some time.
And one of the things that, it comes up with some of the measures that get recommended. Some of these measures that get recommended, first and foremost, come from a place of privilege and come from a place of, let's face it, white people. So, as a white person, me as a black man, telling my, 16-year-old black son to wear a mask outside can be met with some hostility in certain areas. So if my son is going to go into a grocery store at, 9 o'clock at night, and then he just wants to go get some candy, going in wearing a black mask like that with a hood on may lead to some things that, is going to be unfortunate and can be perceived as a threat. And so that's really the difficult thing. Staying at home. I mean, we have a society in which we have quite a few homeless people in America. We have places in the country in which we don't have clean water. I mean, we still are dealing with Flint. So some of these measures, we have to really, as a community, kind of come together and band together, because we know individuals within our community that don't have the same sort of resources that some of us do. And so to that point, we have to be cautious when in giving some of these recommendations as far as, even masking up. It's something that, I told my son the other day, I don't necessarily know if you should wear a mask in this community if they're not used to seeing you walking around this area with a mask on.
That's a really great point, because I remember on social media seeing these two gentlemen being walked out of a store because they did come in with masks on. And even after the folks in the community had mandated that masks be worn, they went in and they were escorted out by the police or the security guard, whoever it was. So we do have to be careful in the recommendations, what we're recommending for our own folks. So the question is, what about multivitamins moringa capsules, elderberry, zinc, and vitamin C. So I'm wondering if she's saying, will that help boost the immune system to fight COVID-19? Anybody can answer that. And then anybody?
I think taking vitamin C and zinc, we know that zinc helps to stop a cold earlier than it would if you just didn't take anything. Vitamin C is always good. You can take some vitamin C. In the beginning, they were saying elderberry was not good because it was causing the virus to be more inflammation in your body, if you will. But now we're seeing that we really don't know. So you could do elderberry, just be careful. So I think the most important things, some of the top things that you want to do that are kind of conservative management, get some sleep if you can. I know it's hard to sleep when we have a lot on our minds. Meditation. If you can meditate, prayer is meditation. So maybe you want to pray, get a prayer partner, prayer groups. You know, a lot of people are doing prayer groups on Zoom now. So that might help ease your mind so that you can sleep. Drink lots of water. Water and sugar-free Gatorade. You hear I said sugar-free, okay? And exercise is going to be important. One of the most important things is to get your vitamins from your food. Let your food be your medicine. So vegetables, 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 vegetables. Fruit, fruit, fruit. Unless you're diabetic, don't be eating a lot of grapes and watermelon. Don't do that. But it's just going to be important for you to do some of those basic things. And even back in the day when we get sick and mom would give us warm tea, chicken noodle soup, go to sleep. No drinking ginger ale and eating saltine crackers and watching The Price is Right is not going to get rid of COVID-19, y'all. Okay. But drinking some ginger ale and some saltine crackers might make you feel a little bit better. So just do some of those basic things.
Okay. And so when we were having this discussion, probably the other day in our prep call, Dr. Noble, you were talking about the history of how doctors used to partner with salons and barbershops to make sure our people were getting the health screenings and things that were needed. Can we talk a little bit about that before we get to wrapping it up?
Yeah, I think that when you look at COVID-19, it's the wake-up call that America's needed, that our healthcare system, if we can truly call it healthcare, isn't working for a significant portion of our population, in particular Black folks. And when you look at, the disparities that we see, this should be a wake-up call, to a lot of people that we need to do something different. And I challenge, us to really look at, the industry of hair care. The barbershop and the hair salon has been a foundation, an institution within our community, in which it has been, after slavery, kind of that foray into entrepreneurship. It was the first thing that we could do to kind of establish ourselves as free and be able to put food on the table for our communities. And at one point, barbers were barber surgeons, and the barber pole that is red, white, and blue, it was red for the arterial blood, blue for the venous blood, white was the bandage that the barber surgeon would put on you, and the staff itself was that stick that someone would grab onto that would sit up here, as they were getting cut, the client would grab onto the staff. So there's been studies that have suggested that doing blood pressure screening, diabetes screening in the barbershop can be helpful. You can have a dramatic decrease in high blood pressure rates as well as compliance with diabetic medications when you have that sort of screening done in the barbershop. And what I challenge is that we look at that as a model to see how can we get that to work? How can we use the network of Black physicians that we have, the entrepreneurial spirit of barbers and hairstylists, the fact that that industry has been recession and depression proof. In 1936, during the Great Depression, the hair care industry made $6 million. One of our first Black millionaires was, Madam C.J. Walker. So when we look at that industry, an industry that did not get supported with the CARES Act, we should really, as a community, look to barbershops, hair salons, and churches as that institutions that can help get us out. Because as we discussed before, having faith within the healthcare system or lack thereof has been a detriment to us. And so when we start talking about getting your vaccine in the fall for flu, to take care of yourself, to go see the physician, The fact that you can have, when you come see me in my doctor's office, your blood pressure may be 20 points higher than what it normally is. However, if you get it checked in the barbershop or the hair salon, it may be 20 or 30 points lower. But when I see you in the in my clinic, I'm going to be making management decisions based upon that number that I saw in my clinic. But if I saw your numbers at the barbershop, you may not need to be on blood pressure medication. So I think this is an opportunity for us to say nothing's out of the realm of possibility, to look at barbershops, hair salons, and bringing the two together, working with our civic leaders, public health, and trying to figure out what's the best way for healthcare to be delivered in the Black community.
That's an awesome idea.
I think that is fantastic. And I think we should get to work on that like post haste.
Yeah.
Because I think that there's so many things that are going on. We've lost trust in the medical field, but we do trust our barbers and our hairstylists because we see them more often. So maybe if there's some barbers or hairstylists that would be interested, or some physicians that would be interested in kind of coming together and collaborating on what this would look like, I think we should set that up. And you can do that by going to www.bsba-ca.org and sign up to become a member of this awesome association, because I think that it's on us. It's going to be on us to figure out a solution of how we're going to help our people, right? And be intentional about the way that we put these thoughts out there, or these suggestions of how we're going to move forward. And I saw a question that says, how should we protect ourselves going back to the salons and barbershops? And I'll get to that question you just put up. I'll get to that after this one, but we want to just take maybe Dr. Joby 30 seconds. How should we protect ourselves going back into barbershops and beauty salons?
Yeah, it's a great question. So one of the things in physicians' offices that you have probably seen if you've gone to one in the last couple of months is that waiting rooms have been sort of evacuated. Basically, there's sort of one at a time, and most other states who have allowed barbershops, beauty salons to be able to open back up have basically had to have one customer at a time, and that is difficult because that is that has some pretty severe economic consequences for those barbers, shops, and beauty salons that are trying to continue. But that it's going to be how it kind of has to be. That may end up having to kind of be the new normal, and that's an unfortunate sense, in a sense, but it may have to be that way. It's going to be helpful that barbers and beauty salons are going to be able to gain the trust of state powers, because they are going to be able to tie their ability to continue opening to the results of those early adopters of the looser restrictions. So one of the things that I was taught early on in my addiction training was trust. Trust is something that you gain, and you gain it in drops and you lose it in buckets. So drop by drop is something that we're going to have to work on here to be able to get businesses that are pretty important to our community to be able to open up and potentially flourish again.
Thank you very much. And we'll go to this one last question because I want to wrap up right at the 1 hour mark. Do you think vaccines will be forced upon individuals? Dr. Fields Gilmore, do you think vaccines will be forced?
No, I don't think that vaccines are going to be forced, not in America. And I'm just going to stop there.
Thank you. So let's just go to final thought, because I think that we really need to go back to the basics and really get that barbershop, beauty salon, doctor, church relationship solidified. I think that's going to be important for us moving forward. So with that, let's go to final thoughts. 30 seconds, if you will. Let's start with Ms. Brittany. Final thoughts.
I just would truly emphasize that implementing progressive relaxation, whatever that means to you. So if, like my other panelists said, if that's meditating, prayer, just implementing something to lessen the anxiety, being able to sit comfortably with your thoughts, being able to use this as a positive rather than having a negative outlook. That's essentially what I was trying to say. So I would really, really stress the importance of progressive relaxation, a strong advocate for sleep, It does improve the overall mood, less mood fluctuations, less irritability, things along those lines. And lastly, I do feel that working with the barbershops and connecting the healthcare medical professionals would be a great way of strengthening our network.
Thank you very, very much. And thank you for being here. Let's go to Dr. Fields Gilmore, please. Final thoughts.
What I tell my patients is, number one, always ask questions. Be sure to get in contact with your physician if you have one. Try to find one if you don't have one. And like I said before, some of the most important things you can do for yourself are things that you can do at home. So just go back to the basics. Try to get as much sleep, drink water, exercise, eat a good balanced diet. And do the things that we've asked you to do as far as social distancing. And yes, you have to consider the safety of wearing a mask, especially with African Americans. But if you have a mask and you can do it safely and you can do it healthily, please do that. Wash your hands. Don't be going to gatherings, even though the country is starting to open up. Use your discernment, use common sense, and use wisdom so that we can all get out of this okay.
Thank you very, very much. Dr. Joby, 1 minute. Final thoughts, 1 minute.
Sure. So we're going to have to manage this a little bit like we manage chronic conditions. And so when you manage a chronic condition successfully, you do a few things. You have to be self-aware, sort of aware of your own limitations and your own strengths. You have to be able to stay accountable. You have to be able to face resistance and look it in the eye and get honest with yourself. You have to look at your internal vulnerabilities. You have to look at the ways in which you might be responding to something like an internal need within, and you have to be able to respond to pressure from other people. So all of those things are going to come into play when we're trying to figure out how we make a personal response to COVID-19's presence and how we make a community response to COVID-19's presence. So we're going to need to be able to be advocates for our own community here. Early on, we did not get adequate testing, even when we were coming in with similar degrees of symptoms. That's fortunately starting to change now, but we're going to have advocacy for ourselves around this. If you, as Dr. Fields Gilmore mentioned, if you're sick, please make an appointment, go there. African Americans do not tend to get great medical care. There's a lot of reasons for that. Some of those that we can control, though, are the ability to self-advocate and the ability to know your own body, know when something does not feel correct.
Thank you. And last but not least, Dr. Noble, your final thoughts. And it looks like we got a little under a minute, so go.
So I'd like to thank the BSBA for taking this opportunity. I think it's very important for these platforms for Black physicians and we as a community, Black healthcare professionals, to be able to give the word out in plain speak and be able to talk to our own people. I'd also like to take a moment to recognize all the healthcare workers, all the Americans. Pretty much everyone has really been in this fight together. So I thank you all for your support, and we're all in this together. The key to this for us really in the Black community is vigilance as far as social distancing, hand hygiene, masking up when we go out in public when it's safe, but also voting. Our local leadership is important, and we've seen that time and time again, that it's really the local leaders that have really helped us in a pinch. State elections are important, and of course, the national election is important. Leadership is key. And in this age of COVID-19, it has been the wake-up call that we as a Black community need, that we cannot go to business as usual when this is all said and done, because business as usual wasn't good business for us from a healthcare perspective. So we should be challenged to change the status quo, to do something different. And this opportunity of COVID-19, in which we're kind of hunkering down, should be a time in which we kind of put our heads together to think of how can we really change the narrative, change the system, and do better for ourselves as a community. Thank you.
Thank you very much. And with that, we'll wrap it up. Thank you all for joining us. We'll see you on Tuesday. I believe Nikisha has the music industry in the building. So we'll see you on Tuesday. Thank you for coming. Like, share this video. And also, if you want to become a member of this organization, please go to www.bsba-ca.org. Thank you very much, and we'll see you next time.